welcome all of you here. And it's on behalf of Caregiver Sati, I, Aditi Sharma, welcome Anjali, Uthup, Kurian. I hope I pronounced it right.
It doesn't matter.
Okay, thank you, Anjali. You look absolutely beautiful today, and we hope to learn a lot from you. So, starting with the initiatives, I'll just tell a little bit about it. So, we are starting and launching our initiative Ask Me Anything. It's for our caregivers and for everyone who can come up and ask life questions and get help and get expert advice on any issue, any any disease, any mental health issue, palliative care, and anything that you are having like any doubt and you want an expert advice. So it's a platform for all the caregivers to come here and ask questions on literally anything, your day-to-day issues related to health issues, anything, and it's a safe space. So I welcome all of you here and I hope it really helps you. And we hope that you also come again. It will be a monthly thing, so yeah, it will be great. You can get all your answers sitting at home, and literally day-to-day problems can be answered. Um, Beside that, I welcome Anjali. She is as beautiful as she's looking.
Oh my
So
God.
a little bit about her. So she is a caregiver herself, and she is also an RJ at Radio Mango, founder of the Sunny Kidney Foundation, and is also a certified nutritionist for renal conditions, where she explored the ways for kidney patients that they can look into their diet and they can help heal, chronic illness and actually be happy with their illness from their diet. And I think from you we can learn a lot about specifically about kidney disease. So I would give the platform for you to share about yourself, your experience as a caregiver, and your journey so far. So to you, Anjali.
Thank you so much, Aditi. It's just a pleasure to be on this platform. Honestly, Caregiver Sathi and me go back a way now, and it's just been able to put so many things in perspective. Normally, we're always having people who just give us verticals of problems and we have no solutions. Being associated with Caregiver Sathi gives us all an opportunity actually to explore solutions instead of constantly creating a mammoth Gerontian structure of, more and more brick and mortar and building more buildings, which are the verticals of our problems. So I think here at Caregiver Sathi, the expertise comes from people who have lived experiences, who live every day with it. And as I remember a doctor once telling me that there's nobody who saves a patient more than a caregiver, not even the doctor, not even the medicine. It's the caregiver that comes along and gives most of herself or himself to his patient or her patient. So, yes, so it feels wonderful that I can be here and share with you the experiences and the nuances of a lot of things that we have been doing.
Yes, thank you so much for coming. And I would like start by asking a question that I have sort of wondered about. So I'll just ask you that first, and then we can go on taking questions from people. So the first
Sure.
question that I want to ask you is, what are common non-specific symptoms of chronic kidney diseases? Something that is
Okay,
not so
so
mainstream, and we often not identify them.
So the thing is that if you're falling sick quite often, you're having edema that is swelling around your ankles, you're having discoloration of your skin, and also if you're having any kind of repeated UTIs or sometimes even difficulty in passing urine, would be probably the first flags to look at.
Okay. Okay, so we do have a question. So what do we do once we have the news to go for second option? So once we know that the patient is diagnosed, so what do we do?
So the thing is that once you know that your patient has been, diagnosed with some kind of a kidney disease, obviously the first reaction to everybody is in the family and the patient himself is going to be of extreme shock.
Hmm.
Okay, then it's going to be of disbelief, then it's going to be of anger
Hmm.
कि ये मेरे साथ क्यों हो रहा है, and
Definitely.
then finally it is going to be an acceptance. But in the process, it's not necessary that when you go to the first doctor that you believe in that person. So you would need to go and take a second opinion. Now, second opinions are as well opinions, and then it could go into third and fourth and fifth and sixth, and you never know where you're going. So, what you really need to do is if you go to the first person and the first person gives you a list of these are the things that you have, when you go to the second and the third, you start ticking off the common ones. So then you're not confused, because second opinions or second options always leave you with a thought process ki, am I doing it right? It's like when you go in for a sale, you just have that one dress that you want to buy, and then you have an offer saying buy three and get two free. Whether you need all the rest that comes with it and you're spending so much more extra money.
Yeah.
So you really have to know the kind of data. And I think when you're going in for a second opinion, places like Caregivers Sati or Sunny Kidney Foundation or Kidney Warriors
Hmm.
Foundation or the different foundations that are run around India would be the place to come and check in, to find out that,
Hmm.
okay, ye mere saath ho raha hai, I've got a second opinion. What do you think it should be? Then all of us who are trained and who will again divert your cause to other doctors, we'll get our own opinions for you, kind of wear it all out and suits you the best.
Okay. Like the thing that you said that there's anger when people often get to know that they're suffering from this. So, I'm wondering like what happens to a caregiver then? Like how that because like often caregivers have to just accept it, even like without expressing it out loud to anyone. So, like how do you think like a caregiver can express themselves without being so probably demanding or like rude to the care receiver? Or because I feel like expressing is an important emotion, right? So like how do you think a caregiver should express themselves?
All right. So, first of all, when the diagnosis happens, the entire family is going through the same thing. They are going through shock, disbelief, and anger at the same time. And most often, your patient comes to you, and your patient who's been diagnosed really has no telltale signs except one test that they did, and the creatinine is high, or they've seen some kind of problem within the ultrasound. So there's as much of shock, disbelief, and anger amongst everybody. It's not just with one person, you see. And of course, when the patient is angry, of course the caregiver is the only person who will stack herself up so that she's got his or her back, and will try to let this person vent, because that's so important, you see. And then the caregiver ends up having a role of not only a doctor, a nurturer, a teacher, somebody who's doing research on the project, and in the meanwhile has obviously understood that it's extremely, extremely important to keep your calm. Not necessary that it happens. And as a caregiver, if you do lose your calm and you do get angry yourself,
Yeah.
there's actually no reason to blame yourself, because it's extremely new to you.
Yeah. Okay, so I do have like questions from other people. So they're asking the Anjali, are you here?
Yes, I'm here.
Okay, I can't see your video.
It will just be on, sorry,
Oh,
because I
it's
was
okay.
on. Yes,
Yeah,
tell me.
so I do have a question by people here. So one question is, please explain the role of nutrition in healing.
Okay, so the thing is that the nutrition is healing is a very broad spectrum, because you're going to be asking what. So now this is specific to somebody who has got renal disease. And the person who is on before dialysis, during dialysis, and post transplant all have different ways of managing their nutrition. Because when you're in the first stage of a renal disease, what ends up happening is you try not to go to the second stage or third stage or the fourth stage,
Yeah.
because that takes you closer and closer to dialysis and more complications. So in that first or second stage, you try to manage your creatinine and all your other labs, like whether it's your potassium, whether it's your sodium, whether it's your bicarbonates. All these things are managed differently. All right. And of course, the most important thing is the amount of liquid taking in. So it varies from not each individual, but from each individual stage. When you're in dialysis, as I say, the dialysis people, the patients are one happy lot. You have never seen a happier lot of people than kidney patients. They have the soul of positivity in them because they always have two options. It's a very sad disease, but you always have an option. Either you can be on dialysis or you can be on transplant. Your transplant fails, you can go back on dialysis. So this carries on going on, you see. But they're a happy bunch. And when you talk about them being extremely happy, I have to tell you, they find ways and means to literally party before their dialysis. So the foods that you can't eat or you cannot be doing certain things, they make sure that if their intake is happening, it's happening the day before dialysis. So when you go in for dialysis, it's all cleared out. Not that I say that it's a good thing to do because you don't want to mess up with what you're eating, but once in a while to be happy is a very important ingredient. In fact, one of the main nutritive ingredients in your life that you should be thinking of.
I totally agree with you. So we do have another question on who is the best doctor to consult.
Okay, so now this question comes with a whole lot of answers. What is the
Hmm.
best kind of person to consult? Initially, of course, you're going to your physician. Then
Hmm.
your physician points out so many issues with you, and then you get pointed over to a nephrologist. Then a nephrologist is one who basically deals with your situation and tells you that, okay, this is wrong, you
Hmm.
probably have to go for dialysis, you probably have to go for a transplant. And then when you move on to the next stage with this dialysis, it's your doctor, your dialysis technician, and then probably a nutritionist who comes under the umbrella. When you go into becoming a person who is going in for a transplant, then you have your nephrologist, you have your dietitian, you have your technicians of your, the people who've helped you
Hmm.
with your dialysis, and then you have the entire transplant team, which is head by the transplant surgeon.
Okay.
So
So
there's
another
really no
question.
best doctor, but I
Hmm.
would always suggest to people, of course, having the most important doctor is very, very important.
Yeah.
But if you have a hospital where you know where and how things work, that you've been going there, unless, of course, there's no
Hmm.
treatment and there's no dialysis unit there, I would suggest go to a hospital where you know the way the administration works, where you know
Yeah.
the didi or the bhaiya or the cheta or chechi who's pulling you on a car, on your or somebody who's serving you food, or the PRO, or those kind of things are very important. A hospital which has had your labs before,
Hmm. Hmm.
so a doctor is very important also, but sometimes you could just have one value ticked off, and that could be the doctor, and all the other facilities may not give you that much happiness.
Hmm. Hmm. Yeah, I do agree with you. That's a good perspective. Yeah. Okay, so the next question is how to deal with chronic constipation that has come as a package with CKD.
Yes. So obviously, I don't know whether many of you are aware of it, but the minute you have chronic kidney disease, that means that your kidneys are not functioning properly. And one of the main things that we all associate with the kidneys is all the toxins being pushed out and then going into our urinary bladder and then coming out as urine. Most kidney patients can't urinate.
Okay.
Okay, most kidney patients cannot even, after some time, cannot even go to the toilet properly because they face constipation, because they have a limit of amount of water they can drink in a day. So
Okay.
if you're a dialysis patient or you're a patient who's pre-dialysis, you will not be allowed to drink so much of water depending on your glomerular filtration rate, which is your GFR. Okay,
Yeah.
so there are people who just have half, maybe half a liter of water a day, or altogether liquids, plus then you're told to have roughage, then you're supposed to have you're supposed to have fiber rich foods, then you're supposed to have this food, then you have to leach all your
Oh.
vegetables, because leaching is a process where you take all the vegetables, boil it, and throw out the water, so that most of the
Hmm.
nutrients don't go back into you, like sodium, potassium and all can't go back, because all these elevate your
Hmm.
issues with your with your kidney disease. So what happens to this person is that they have everything in them, but they do not have enough liquid to remove it. And then even if you do have the liquid removal happening on the other side, it's
Hmm.
basically through dialysis, which does not actually take into consideration constipation.
Okay. So is there like a method of going into a home-based care for patients who are suffering from CKD?
So, see, the thing is that you have to understand that there is two kinds. I mean, CKD is a broad spectrum.
Mm-hmm.
Hemodialysis is not the only dialysis that is available to people. There are
Okay.
two kinds of dialysis. One is hemodialysis, which is normally done through a port. It is done through your through a vein,
Mm-hmm.
or normally made into a catheter if you do not have a fistula. All right. And a
Okay.
fistula is something that I always tell people: the minute you've been gone into stage 3 of kidney disease, get your fistula done and mapped, because sometimes it may not work in the first go, and it'll work in the second go. And basically what happens is, you take a artery and you join it to the vein, and the way the blood flows through the artery starts getting into the vein, making it bigger and stronger, and the flow of blood is as much as an artery. So you keep puncturing that, and you don't have anything that is coming externally into your body, which again can cause, of course, infection. Anything external in
Yeah.
our body causes it. So it depends on, so that is one kind of dialysis. And then you have peritoneal dialysis, which is basically using your stomach as the filter, your membranes of your own body as a filter. Now that can be done at home, because all you need is all the stuff that goes in with peritoneal dialysis. As far as home dialysis is concerned, yes, there are home dialysis options that you can do, but then again, it comes with a price, because you not only have to get just the dialysis machine, you also have to get every infrastructure, which is the back end, which is your RO plant, your water, your connectivity, and of course, not to forget electricity. Other than
Definitely.
that, you need a trained technician to come home. Plus, every time you're having a dialysis, all the system, all the things that you need, your tubing, your dialyzer, all that, emergency equipment, all of that has to be bought and kept in bulk.
Oh,
All right. So that can cost up to 14 to 16 lakhs to set up in your house.
oh my God.
But there are people that I work with and I know of, especially, and at this point, I would really love to talk about this gentleman called Kamal Shah. Kamal Shah has been with CKD for the past 25 years, and he's not just sat down with it and not done anything about it. He's actually started the largest chain of dialysis clinics across India, and it's called Nephroplus. And Nephroplus now offers home dialysis to patients where you do not have to do anything. They come in a
Wow.
little truck. They come into a
Wow.
little jeep with a jeep. They come to your house. They check up everything, and they bring a portable dialysis machine in case you're unable to go, and they do it. So this is a pan India in most of the main cities, and also, like, I know that's in Kolkata, I know it's in Bangalore, I know it's in Bombay. I've seen somebody having it done in Bombay. I know it's there, but if you want any more details, please remember to, ask Caregiver Sathi, and I will get back to you with the exact details and the cost. Otherwise, you could just email me at anjali.kurian@gmail.com, and I'm happy to, answer your questions and get you to the best dialysis system ever possible in India.
That I think would be very helpful for a lot of people because I myself, when I was going through, looking up for the CKD, and I saw a lot of people have started doing home-based treatment. So I was really wondering. Another question that I have is there any insurance covered for home-based
So,
solution?
so the thing is that insurance is a very tricky question, okay? And sadly, in our country, insurance doesn't do very much for a CKD patient,
Um,
okay? In the sense, if you're in the hospital and you have been diagnosed with this, and then you're going back home, and therefore you are unable, you've just had a hip surgery, or you have just you've missed out on dialysis because you're sick, you've got so much of fluids in your lungs that is giving pressure on your heart, you can't move. Then if a doctor gives it, maybe if it's the same hospital and the same center, the billing could be done and you could get your insurance. But normally, home dialysis does not cover, is not covered by insurance.
okay. Okay. So what tips would you give to the caregivers who are looking for renal care, like who are looking after a renal care patient?
So the first thing is that always associate yourself with communities which actually talk about caregivers, communities which help you explore this disease. All right, it's very, very important. And sometimes we may not like to hear what the doctors want to say, and then suddenly somebody will say, "Aap homeopathy le lijiye, aap ayurveda le lijiye." Let me tell you, that's the first thing that you should do for yourself and for your family, is say no to it, because you
Okay.
can damage yourself even more. Because Ayurveda is fabulous for everybody. It's not that it's not. It's extremely fabulous. But in a kidney patient situation or a liver patient situation, these drugs and all are actually getting worked. Where is it getting absorbed? Where is it being metabolized? Right? In your main
Yeah.
two organs, which are these two, and if they fail, you're done for. So a caregiver is, I always say, reach out to support groups. Okay, whether it's Kidney Warriors Foundation, which who I am also a part of, we're one of the largest foundations in India. We totally focus on health of your patient and caregivers. I myself run so many parallel caregiving things. I'm constantly, telling people as a caregiver what you must do. Another thing I tell your caregivers, while your loved one is at dialysis, remember to spend time with the other caregivers. If your loved one is having a good dialysis and there's nothing to worry about, and you have to sit there for 4 hours, make sure if you have nothing else to do that every hour you get up and walk so that you get your exercise in, or you keep walking around the block. Second thing is that go and have some fun. I know I'll be looked at like, what are you talking about? But when my brother was diagnosed with CKD, the first 22 days, all we did was sit in that hospital. Nothing came out of it. Nobody got better, some of us got worse. Okay? So the thing is that, in fact, it sounds really crazy, but when my brother was in ICU post transplant, there was so much of stress of everything else. We had a hotel across the road. I went there and got myself a blow dry. Because if somebody tells me that Anjali, by crying and being sad, Sunny will be cured of every disease, I promise to God I will cry and be sad for the rest of my life. But
Yeah.
it's not solving his problem. Does me being happy and getting a blow dry and going to get a movie or sitting with a friend to have coffee solve the problem? No, it does not at all. But it
Yeah.
makes people happy, and a happy environment facilitates healing. So, all you caregivers out there, please remember there is no award for martyrdom, which is where you are actually sacrificing your health. Remember, if your health goes, every system just collapses.
Yeah.
So, it's the
Thank you for
oxygen mask
saying that.
theory. Please put on the oxygen mask for yourself, breathe, then help. Or put 5 liters of petrol, not going to get you anywhere. That reserve is going to get you to the petrol station.
Yeah.
Okay, so always have that little reserve. It's not selfish. You're actually doing this to be selfless in the long run.
Can you also tell us like what all centers are there that like people can go to, especially like for recovery from CKD? I know it's a very broad question, but like
No, no, no.
popular centers.
They're not. Recovery from CKD is not something that is happening. It's an ongoing process that helps you deal with CKD. Okay,
Okay.
so if you're going to the hospital, I mean, it depends which city you're in. Like if you're in Cochin, you could be going to, you would be probably going to the medical trust, or you'd be going to Aster, or you'd be going to Lakeshore, or you would be going to some of the Fatima hospital, where people are being given free dialysis, government hospitals. If you're in Bombay, you could be going to Global Hospital, Breach Candy Hospital, you could be going to a Nephroplus Center, you could be going to trusts that are doing this. So Apex Kidney Foundation also has Apex also has certain things. So it depends which hospital you're in
Okay.
for your kidney disease. Post your transplant, you will be where your doctor is. So if your doctor moves, most often you will move with the doctor.
Okay. Okay. And is it an inherited disease, or like it's a lifestyle disease also? Because nowadays, like
So
we see diabetes becoming a lifestyle disease, and a lot of problems, even mental health, like depression, anxiety, are becoming lifestyle disease. So, do you think like this is inherited or a lifestyle disease?
So CKD can be genetic, CKD can be autoimmune, and CKD can be a lifestyle disease as well.
Okay. Okay. Can you like elaborate on that? Like, how can it be a lifestyle disease, and how people can sort of work to not make that happen?
So the first thing is that if you have telltale signs of probably having a lot of UTIs, or if you've had a burning sensation, or some days you've not felt the need to urinate, or when you were kids you urinated too much, these are
Yeah.
things that one should get tested. Plus in India we have this unfortunate thing, here shubh shubh bolo. So if you're taking a 12-year-old child to go and get a blood test or something, अरे क्यों लेके जा रहे हो यार?
Yeah.
मत लेके जाओ, शुभ शुभ बोलो क्यों डॉक्टर के पास? I must tell you, if, and I'm saying this on a broad spectrum, if you see a 15-year-old taking an anti-aging cream and putting it on her face, please let her do it. Because the one thing is constant from the day that you're born is your aging. So whether you're 13 or the pink of you 21, 16 and never been kissed, 35 and super fit, or 72, you have equal right to access anything that's going to make your life better and cut the risks of you being sick. So I would tell all parents, including people who do not have any disease, that make it a point that by the time your child is about 15, have one full screening, then have one at 25, have one at 30, have one at 35. I mean, you're checking in every day to check about your nails, your hair, what kind of new treatment you can do, all of that. How come we never check into our health? So please, everybody go and get tested. And in fact, one of the
Mm.
reasons I could have probably been late, but I was not late, is I went to check out all my parameters today. So
Mm.
I've ticked them all off my list.
Yeah.
I've done my blood reports, I've gone for work, I've done mammogram, pap smear, UT, everything, ultrasound, made sure everything is clear because you must do it. You just definitely, definitely.
Yeah. And there's a question which is asking that is difficulty in urination twice or thrice a day alarming?
Hi Renuka, this is Renuka
Yeah.
Bhagavan. I know her pretty well, and she's from the Kidney Warriors Foundation family as well. Is difficulty in urination twice or thrice a day alarming? Yes, it should be alarming if you're not a CKD patient. If you are a CKD patient and you're on dialysis, most people don't urinate at all. So yes, if there is some difficulty, you're having some burning sensation, or you're getting acute pain in your abdomen, like another friend of mine had a pain in his abdomen, went and checked, it was a kidney stone. Many people let that kidney stone go undetected or don't do much about it. And in Kerala, we have this saying, Ottamuli, there's this one day you just take one medicine, it'll all be sorted out. Sometimes, of course, it works, but sometimes it doesn't. So screening all these things, and I mean, of course, you can't be over the top saying, oh, mere anguli kat gaya, now let me go and see the clotting time of my finger. No, I'm not saying go OTT and being totally crazy about it. Every test somebody is doing, you're doing. But some basic things should be done and followed so that we can manage the health of our family and ourselves.
Yeah. And so, can a person have chronic kidney disease without symptoms?
Oh, totally. You could have nothing. You could just have nothing and you could just go for a master health checkup and suddenly find your creatinine is through the roof.
Oh.
Sometimes it's latent, and then of course you have acute kidney injury, which is AKI. That means it goes up really fast and it comes down really fast, and that can be reversed. But in chronic cases, it's obviously been an underlying thing, because whatever, it just doesn't come back and it's not reversible. So
Okay.
yeah, sometimes you can have absolutely no signs,
Hmm.
and then one fine day you just realize that, oh my god, this is what my creatinine
Yeah.
is, and from there it's a totally different story.
And I think it becomes very difficult then to prepare for it.
Yeah, it is actually extremely frightening when you get
Hmm.
diagnosed with kidney disease, because you don't know what you're doing. And then also there's a whole lot of things that factor in, okay? So you've got your kidney disease, you have to go into dialysis. It's like a whirlwind. If I just have to tell you how it was when Sunny
Hmm.
got diagnosed, his creatinine was 11 point something. He had to come down to Cochin. We went into Georgie K. Nainan and Vilesh, and immediately a catheter was put into his jugular. He had to start his dialysis immediately. Then they were doing all kinds of things. He had to do biopsies to figure out what kind of kidney disease, has it got malignancy to it. So it's
Hmm.
just like, it's it's like taking a flight na. You go,
Yeah.
you drop this off, get onto the flight, come back. It's a
Yeah.
conveyor belt. It's just constantly moving. But sometimes I think because so many things are happening, we don't have time to think and start saying, oh Bhagwan. The time that
Hmm.
really the anguish starts is when you start getting into a system, and then you have to go driving to the hospital, go in for dialysis, stay there for 4 hours and drive back. That's when your questions come into your mind,
Yeah.
you know. So it is very tough. It's very tough. But as I was saying, once you land, once
Hmm.
you're grounded, once you got support, once you can manage everything, which is very difficult to do, because I suppose 0.2% of this country can afford this disease.
Hmm.
When you can't afford this disease, it totally different connotation
Yeah.
altogether. And that is something that, I don't know how to solve only.
Yeah. And I feel like in India, that's a major concern.
Actually, I have to say this, whether I don't know whether this is a politically right sentence to say, but I've never
Hmm.
been politically right. And I see after what has happened with COVID, and I see after what has happened all over, जितना भी बुरा है, टेढ़ा है, छोटा है,
Yeah.
मोटा है, लेकिन इंडिया मेरा है. And this is the land of जुगाड़. And we will survive no matter what. Okay, whereas if you're in the States or you're in the UK, the NHS has to kick in. You're on a waiting list forever. If your insurance doesn't come in, you don't get dialysis. You're just left on the road to die. Yeah, the 50 log will take a bucket and stand at some place and say, "Paisa dalo isme."
Yeah, true.
So I honestly say it's sad in India, poverty is sad,
Yeah.
but I a big shout out to the doctors, technicians, and the medical workforce
Hmm.
and the volunteers of our country because they don't let anyone die. I have seen it firsthand. I have worked at government hospitals where you even probably have a dog and a cat inside a dialysis room, honest be God. You can find all that. You'll find even rusted beds and rusted everything. But 99% you don't have sad stories to say. Honestly,
Wow.
medical field in India, God help us all and God help them because they have really been fabulous. You know, India was all out there in the news because they stopped selling
Yeah.
Taj Mahal, they stopped sending the slums that you see as you land in
Hmm.
Bombay, they stopped selling Kathakali artists, they've stopped selling all of that. It's not selling anymore. So let's sell India during COVID. Yes, COVID was bad in India. It was bad. But that's because you could buy our photographs much easier than you could buy anything else, right? Everybody else has such tough press rules. You could have freedom of speech, but everything is still closed door about what happened. But honestly, because of this one thing is that way Bharat is Mahan.
I do also feel proud as an Indian after hearing
I
this.
feel very proud. I mean, I have to say it because I've seen it happen.
Yeah.
Yeah.
Yeah. Also, are there different stages of kidney diseases, and how do I, as a caregiver, be prepared for each stage?
So actually, normally there is one, two, three, four, five. Okay. The first time when we have the first and second stages normally get not noticed because it happens and we've not diagnosed it. Normally, when we get to know it's already the third stage or the second and third stage. At that time, you're just trying to manage. The caregiver is trying to find out how to manage because it's got to do with food, it's got to do with the amount of water, it's got to do with supplementation of certain medicines, constantly monitoring diabetes and also looking at blood pressure and stuff like that. Once it goes into the fourth stage and fifth stage, that's the time when you're knocking on the door for dialysis. So then that care becomes very different because that involves you going to the dialysis center or going to figure it all out. What are the medications that you need? You have to bring in factor in costs. Are you hemoglobin is really low, and that happens to most CKD patients because, as you know, erythropoietin is not. Most people don't know. Erythropoietin is actually made in the kidneys, and that is what is used to help with bone marrow production and stuff like that. So your HB is low, then you need to get injections for that. So then it becomes quite a cross country because you are dealing with statistics from transport to food to finance to hemoglobin checks to everything. Yeah, so it's different in every stage. And then once post transplant, the first 6 months is difficult because you literally live how you live when you were in COVID, when you have COVID, in total isolation for 3 months. You make sure that nobody else comes in, you have to be masked, you have to be sanitized. So we had a laugh right through COVID because we were used to all of that. Masking up and sanitizing was not a big deal for a CKD family patient or a transplant family patient. But yeah, so that takes a lot to be able to say no to people to come. People want to come and visit you. Are bhaiya, you can't. Then people come
Hmm.
and say, don't worry, I've just got a sniffle. You have to say as a caregiver, if you've got any kind of disease, including a toothache, please do not come to my house. you know, and be a
Yeah.
little crazy and go a little OTT and wiping off the handles and things like that. Of course, your patient can come out and sit if there's a 15-foot difference between a person who's come to see them and got absolutely no issues but is wearing a mask. Yes, so care
Hmm.
differs for each and every stage. And
So,
also, one piece of advice to the caregiver,
yeah.
please remember, other than you giving the caregiver, as a caregiver, giving any love and affection and taking charge of medicines and all of that, the eventual truth is that you have a whole doctor body or hospital body looking
Hmm.
after your patient or your relative or whoever it is. But there's nobody there looking after you. So you have to take time out to go. You have to start calling in people who know, can understand where you are from. So I always say if you're in Cochin or you're in Bombay when I'm there or wherever, call me up. Caregiver Sati will give you your number. I will understand your disease. I'll sit in for you. but go get your hair blow dried, go to the market, go to the temple, do something that makes you happy every single week. I would like it every single 3 days. I didn't have the wisdom those days, but every day if you can do something that makes you happy, because no one is looking after you, darling, so you really need to look after yourself.
Yeah.
And
And
find people who want to be friends of the caregiver. That nexus of friends, you need a village to go through CKD or a transplant.
yeah. So there's another question which is many of us rely on information online a lot. So what is a healthy balance?
First of all, I would say that if you go online, you will find 5,000 million pages on this disease. And I can tell you this number because my father would print out this much. Till one day in the hospital room, the hospital told us, "Sir, you look like a kabadi. You have collected so much of papers over here." First
Hmm.
thing is to basically go and Google and see if you get a Wikipedia answer, just to get yourself little accustomed to the knowledge. Okay, then you need to rely on your doctor. Then, as in our Indian families, like in a shadi, you'll always see one foreigner
Yeah.
somewhere. Like that, some relative is married or is post-called. So you will get a second opinion from there. Then, as you start educating yourself through sitting with patients and their bystanders or their caregivers, you get more and more information. Then you even know what to search for.
Hmm.
You see, because a person who's
Yeah.
got diabetic nephropathy, that is a person who's suffering from CKD because of diabetes, his line of treatment and everything will be very different from somebody who's suffering from hypertension, because there's a whole different drug portfolio that goes in there, right?
Yeah.
So don't rely only on that. And now you don't need to really rely on much. We're all here. Caregiver Sati is here. Call us, be with us. We're always here for you.
Yeah. Okay, so like we'll be ending our session shortly. So if anyone has any further question, do pin it fast. We do have a question. What is the essential equipment to keep in the house?
So, essential equipment to keep in the house in regards to what, Bhavna? If you could quickly type that and let me know. Is it in regards to a kidney patient, a transplant patient, or generally? Well, if it is to do with a CKD patient, I would always suggest that you have a diabetic monitor at home, a diabetes monitor. You have a BP machine, and of course, you have now a oximeter so
Hmm.
that you know all of that. And an oximeter is very actually quite vital for a kidney patient, because sometimes what happens is if you miss a dialysis or stuff like that, the water starts overflowing and your entire internal organs like start becoming like marshland, and they start
Hmm.
swelling up and they all start pressing against each other. Then your lungs get incapacitated and then your heart. So it's very important to have an oximeter at home. Yeah, nowadays you do get nice machines which are smaller, which is like till you can reach a hospital to an oxygen machine at home in case you have any kind of trouble breathing.
Okay. And what is the best way to plan for the care?
So the best way to plan for the care is that by the time you've been hit by it, you've already started going in through many of the motions of running here, running there, and everything. The best way to plan is actually to have a routine. And all human beings like a routine. So Monday, Wednesday, Friday, agar dialysis ke din hue, so then which is the follow-up day? What are the things that have to be the other day? So always have a routine set for yourself also, because as a caregiver, only then can you manage it, because it's a mammoth task.
Yeah. Okay. And when it comes to kidney replacement, what's been your experience and advice?
So, kidney transplant is basically a long process, okay? Because there are parts of India that believe that you can have a live related donor, and that is, of course, most of India has that, or you get onto the cadaver list where you get an organ from a brain dead human being. Parts of India also believe in unrelated live donors. And of course, it is to be pushed as to being altruistic. It has to be passed over so many committees so that there is no racket, of any organ trade happening in that.
Hmm.
People take to it. Most people have successful transplants. Like I know people who were on our show the other day for Kidney Warriors. Sharma ji and has been on the same kidney for 42 years. Prasanna for 25 years. Then we have, somebody like Kurian who's on his fourth transplant. So, it depends what suits you. My brother is happy to be doing dialysis, as is Kamal, as is Sejal, for the past 13, 12, and 7, 25 years, because it suits them. So, transplantation comes with no guarantee. You can
Yeah.
lose your transplant on the transplant table, and you can lose it 41 years later. But the most important thing with transplantation is to always remember that you're doing it for the good of the person, and it can go wrong. And in this entire thing, whether it's CKD, whether it's liver disease, whether it's cancer, whether it's any of these diseases, the most essential equipment actually to keep in your home is hopeful, happy humans, which I call the three H's. Hopeful,
Wow.
happy humans are the only way to go, honestly speaking.
I will write that down. Okay, this is a very off question. Not off, I've not written it down, just came to my mind right now. But what are like the essential nutritions you would tell, like the caregiver and also the patient who's going through CKD to keep in mind and to not ignore and avoid it?
See, water intake is one very important thing. Okay, and when your doctor tells you 650 ml, try to stick to it. I know it's horrible when we are drinking gallons of it. Okay, but it's the only thing that's going to keep you in good stead. Salt. It is something that I learned from my brother's nephrologist, Dr. Georgie K. Naiman. He used to tell us, cook, put no salt in Sunny's food, and just take, the ice cream ka spoon jo hota tha, ya purane zamane mein that plastic spoon that used to come with your cough syrup. He
Yeah.
used to say, just take that much of salt, which is about 5 grams, and leave it on your table and sprinkle it. The first few weeks, you will use all of it. But over time, you'll realize you don't need most of it. A third thing I would tell everybody is to be very, very careful of the amount of sugar you eat. Even if you're not diabetic, sugar causes inflammation in your organs, and I cannot tell you more about it. Okay, I would probably need 17 sessions from Caregiver Sathi to talk about that. But sugar, as in anything which is sweet, causes insulin problems in your body, causes diabetes, but more importantly, it causes inflammation, and you don't need any more inflammation. So these three things are definitely a no. Processed foods, healthy soups, please learn to read the labels, because they'll say, oh, there's nothing in it, but your sodium levels are through the roof. People who are on dialysis and transplant patients or CKD patients, please never have a diet coke in your life, because the sodium levels are so high. And all my apologies to Coca-Cola, but you know something, I mean, that's the savior for us to drink all the time, because hey, I want to have a Coke, but it's 0 calories, and I've got only 750 calories to go through today. So great for all of us. But people who have CKD and all of that, if at all you need to have it, have the real thing. Do not have a diet anything. Never have a diet anything, because
Okay.
there's something else that is making it be what it is for you. It's not
Yeah.
real. And as far as the caregiver is concerned, make sure you get in at least 45 minutes of exercise. And you're like, how will I get it? I'm doing khana, pina, ye, wo, everything. You have to find 45 minutes for yourself. Follow the rules of, not water, of course, but processed foods. Try to avoid it. Try to avoid extremes of sugar and salt. I have to tell you, it's the biggest killers of
Okay.
lifestyle diseases. Yeah.
Thank you for sharing that. And we'll take one last question and then we'll end the session. So, how can one explain dignity in care?
Well, thank you so much, Ilyona Rosaline. It's so nice to have you joining us. Yeah, so actually, dignity is a very, very important thing. And the reason we end up not having dignity towards our patient or treating them with dignity is because we are so spread out thin. We've spread ourselves out so thin. So all the frustrations and all the things, that anger that we have over time, because they really can't appreciate us, they have their own illness to go through. But you're looking like a total rag. In the meanwhile, your nails are broken, or you don't know where the next meal is coming in from for the house. Uske upar you have to go and clean somebody or face them or face their wrath. You become very, very detached and become kind of like a, what do you call it, like a rakshas. You just become angry. And that comes because of you're not taking care of yourself. So if you start taking care of yourself, you'll find dignity within yourself. you look in the mirror and the biofeedback that you get of yourself is like, oh my God, okay, I'm looking good today. I can make a better day. When you go to meet your patient or the person in your life who you are a caregiver to, when they see a smiling face or a prettier face or a smarter face or a more handsome face, the chances of them to get angry are little less because पहले तो चौंक जाएंगे कि अरे ये तो इतनी अच्छी लग रही है. So when you look after yourself and you start feeling good about yourself, you're going to facilitate people feeling good about themselves, and that's where dignity comes in,
Yeah,
you know.
it's a very important component. Yeah, and
Very.
I got so excited, or like I wanted to know more about like how would you place creative expression as a medium of healing with patients and also caregivers who are going through this
So
process.
I have to tell you, nowadays there's so many things that are happening. You know, this world has got enough happening for everyone to survive. I think as much as we abuse online platforms and WhatsApp and Facebook and Twitter and everything, Instagram, TikTok, Snapchat, arey bhaiya, it's given us a platform to talk. It's given us a platform to understand something else. So I actually did an art therapy thing with the Art Outreach Society in Kerala, run by my friend Tanya. And I can't tell you, it was such an amazing thing. I was feeling stressed about a lot of things. By this time, my brother is way into his disease, and we've all accepted it. So we're in his room while he's having his dialysis, and we're all sitting and having chai and chanachur and having a really good time because life has become normal, the new normal. But what I did with Towers, the Art Outreach Society, was I had to draw. Okay. And the first thing is that competitive spirit that's like, oh my God, I need to draw fast, I need to draw the best, which is a good thing. That means you're alive. You've not just got sucked into some stupid feeling sorry pity party for yourself. Then you start thinking of beautiful things that you would like to have around you. I can't tell you, at the end of that 15 minute, I had tears in my eyes. I cried. I felt purged, and I felt so happy that I could remember so many beautiful things that I wanted in the sitting room of my house.
Wow.
So, music, art, going out for a movie, making something at home, cleaning up some junk, lighting a lamp every day. You know, these rituals actually take away from what is actually saying the Gayatri Mantra or the Our Father or saying your namaz. It's a routine, right? It's a routine that you stick to. And while you're doing that routine, you remove everything else. And because it's God, you evoke him or her in silence and total dedication. So when you do that every day, like when you're cooking, if you're just cooking, of course, now being who I am, I'm multitasking all the time. But there's certain times in my life I will not multitask.
Yeah.
When I'm here with you, I don't know what is happening anywhere else. The phones are not ringing. Anyone could be standing on the side of my door. No one will get my attention because it's as you say, my religion. So certain things like your walk, your morning cup of tea, who you're helping has to be your religion. Don't multitask at that time. You know, just focus and keep a routine because that's what actually keeps us going. It's very, very important. I never knew I'd ever say that. My mother used to say that to me as a child. Say, have a routine. I said, nah, never. I was a rebel without a cause. But now I have to say thank you to my amma for actually doing that for me.
Yeah. I think talking to you has also made at least me realize that how times have changed in terms of care. Like everything has become so open, and there's so much there is that can help us actually take care of our mental health. And I think something that I all of us should keep in mind is what you said, like a happy, healthy human. Oh yeah, that's it. Yeah, a healthy, hopeful, happy human.
Yeah.
Yes, that's the word.
And
So
also,
I
you
think,
know, Aditi, I just feel that life, like so many times you are shamed because of your disease, right?
yeah,
How old would you be, Aditi? I suppose in your 20s, right? You would be in your 20s. Yeah.
I'm
Now,
on my 20s.
you must be my daughter's age. So I'm saying when I was growing up and I first got my period, it was like, oh, don't tell anybody. Don't do this. Don't do this. Here today, openly, people are talking about menstrual cups, talking about, pads which are very good for you. Nobody cares. They don't worry about it. Said, it's such a woman thing. I said, no, it's not. Actually, it's a man thing also. Because
Yeah,
a man must know how to treat a woman while he's in that. It's a conversation between two people, right? So I'm so happy that the chances of getting shamed for being a CKD patient, a cancer patient, a mental patient, somebody with disabilities of hearing or seeing or speech, it's nothing wrong. you know. And I think the best thing in one way that happened was COVID, because everyone wore a mask. Otherwise, when you saw a cancer patient or a CKD patient wearing a mask, the first thing is, oh my god, he's not well.
Yeah.
So now I just feel that there's so many more platforms to talk on, so many more platforms where you can interact. There's something for everybody. There is something like I have a CKD patient who I know as a friend right now. He is not at all ashamed of his disease. And
Wow.
Ali is a fitness instructor. the
Oh
days he
wow.
is not the days he is not doing his dialysis, he is training people and earning his living with dignity and with no shame. So I'm saying is that we have so many more platforms today. And I say, this is anything, I take this baton and I hand it over to you, Aditi, because y'all are the generation now who's going to make it matter. It's going to make it easier, because you've made so many things easier for us, right? The transitions from all the, your sexuality to, which gender do you belong to your pronouns, to how do you behave in society, all these things. So I really feel that we're in very safe hands.
I think we would credit you all because, I mean, hadn't been your initiative of, Sunny Kidney Foundation or even like Bhavna's initiative for Caregiver Sati, I don't think so we would have talked about care in this way. And having said that, like, I would often bring everyone to the light of, Caregiver Sati that, we are an ecosystem that help you and we can help caregivers through your journey of any disease. So you can get to know about us more and you can get to talk to expert about anything that you're facing. And it's a platform for, as you know what Anjali said, community. And we all need a community. I think it's a big thing. I also realize that when we have, when we're just one, it won't work. When I have the support of like two, three, or more people, a community, then I can fight it through. So everything is possible in this world. That's what I take out from this session. And everything is possible if we have a community. So I would highly request everyone who is listening to come up and do share your story and join us, talk to us. We are on all the platforms: Facebook, Instagram, LinkedIn, and we also have our website. So you can just type Caregiver Sati on Google and go through it. So it's this initiative. Ask Me Anything will happen every month, and we'll have experts talking about diseases, about the caregiver journey, which will help you. And as I said, you can, it's a real time solution, so you can come and join. And thank you so much, Anjali, for coming. It really, really, I mean, I think I've learned a lot in terms of being happy, like even with the disease. So thank you for, like, making, like, gathering that acceptance that yes, you can be happy with the disease.
No, I can tell you the reason I can be happy, you can be happy too. Think it's a horrible morbid situation, right? But somebody close to you has died and you're at a funeral. You mean to say you didn't smile even once during that funeral? Of course you did. Somebody did say something to you. There was a joke being cracked. The human mind and the human heart is capable of so much, and there's so much of love. So I don't think that one thing, this kidney disease, can rock your boat, but it cannot destroy you. And now it can't destroy you because we have Caregiver Sati, we have Nephroplus, or we have Kidney Warriors Foundation, Sunny Foundation. And look at what has gone viral right now is, Ratan Tata inaugurating an elder care thing. So, if you want, volunteer somewhere, because I do believe everybody wants to do something good once in their life. So, join our forum, come and talk about it. Say you want to be part of Caregiver Sati, do something good for your neighbor. I'm telling you, you're going to be happier all the time.
Thank you for your time and thank you for all the, I think, wisdom you have given us. Thank you for that.
Thank you, Aditi. Thank you so much. You've been a fabulous host. And thank
Thank
you,
you.
Bhavna. Thank you, Nabia and Vimla, who've been working behind the scenes. And thank you all for
And I
listening.
wish you good health and happiness. Yeah.
Thank you. Thank you so much. I wish you the same. I wish everybody the same.
Thank you so much. Thank